I was recruited right out of residency to be a leader, an anchor doc of Team 2. And that made total sense, given my training in team-based care at Brigham and Women's Hospital. Actually, let me take a second to tell you about my training in team-based care. Okay! So, no training, and I come in and I'm in charge. That makes sense. Now, the thing on all of our minds at that time was, how do you take this multidisciplinary group of people and get them to connect, let alone collaborate? None of us had experience with team. None of us had experience with some of the different professions that were now on the team. And Stuart, our medical director there on the left, set up this orientation, 2 days of orientation. And the first day, he said, I want you guys to introduce yourselves to each other, but no resumes. I want you to tell a story of why you're here. And all the docs were like, story? So we heard stories that morning. Amazing stories. We heard the story of a medical assistant who was part of this practice because she wanted to give back to her community, the community in which we were located. We heard the story of a doc who's part of that practice because she was completely sick and tired of being part of care delivery systems that didn't work for the patient and didn't work for the provider. And we heard the story of a social worker who's part of that practice because she wanted to deliver to her patients the support and resources that her alcoholic, drug-addicted father had never received. Completely different stories, totally different experiences, and yet we realized in that moment that we shared something powerful. Values. The moral compass of our lives. Now, why is that important? Well, our teams are becoming more and more diverse, right? More and more people are on our teams who don't have the same professional experience, credentials, they can't tell you residency stories, right? We have less and less in common, but we share those common values. And the beauty of stories is that stories broadcast our values. Resumes don't, but stories do. They transmit our values to other people without having to explicate them. They share them not as abstract principles, but as lived real experience. Not as something we aspire to, but as baggage we carry around that forces us, strong-arms us into making choices when we face particular challenges. And that day when folks told their stories, they were broadcasting their values out there like a Wi-Fi network that anyone could tap into. Shout out by shout out, we were not just celebrating each other, we were defining we. We were defining what we do and what we don't do. We were showcasing what it means to lead and operate in a world of uncertainty, and what it looks like very practically for someone to see a problem and step up and step out. And we humans are constantly looking to each other for information about how to operate in a world of uncertainty, and story is a very powerful way of showcasing that. People talk all the time about culture, culture. Oh, what do we do about culture? Culture can be managed, and storytelling is a tool of managing culture. So here's the question I want to pose to all of you. To what degree are you already using story in your day-to-day practice, not just with patients, but for team building, leadership development, recruitment, establishing a culture of we? And what would it look like to use it even more? What would it look like to create space in your day-to-day to do storytelling and model storytelling, and not just tell stories about badness happening to patients, but stories about how you responded, things you did, what it looked like for you to step in and step up? What would that look like? What would that look like for you to develop an inventory of your stories? Think about that for a minute.